Welcome to Caring Well. Welcome to Caring Well. Welcome to Caring Well. Welcome to Caring Well. Caring Well. Welcome to Caring Well. Welcome to Caring Well.
Welcome to Caring Well, Middleton Pediatrics podcast. Today we have a slightly different show, and our very own Dr. Von Edwins is going to join us. He and I are going to sit down and discuss a random collection of pediatric topics, and we're going to do this periodically. Every 4 or 5 shows, it'll be the two of us. We will introduce other team members during this time. Today, we're going to spend some time getting to know him. I know most of you probably already know him, but we're going to find out a little bit about him before he joined us. Also, we would love to have your questions that we could respond to during these episodes. So there'll be instructions for you to submit those in the show's description. And so enjoy this conversation between myself and Dr. Von Edwins. Dr. Von Edwins.
Hey.
Yeah, welcome to Caring Well.
Thanks. I'm happy to be here.
Though, you're not here as a guest. You're here as a co-host.
Great. Love it.
So you should be welcoming me. This is going to be a little bit of a different episode than what we've done. And as you and I have talked about, we're going to do this recurrently. We're a little bit of a mishmash.
Sure.
We need to come up with some name, whether that's pediatric potpourri or something, where we sort of just talk about a number of different things. I know you want to talk to us about some summer things, some summer childhood things, which will be fun. We're going to briefly talk about our vaccine policy as an office. And so that'll be, I think, helpful and good to try to articulate. And then we'll just run through some quick takes on what's maybe a few headlines that have been in the news. But before we do any of that, because it's the first time, I would love so many people have already gotten to know you in the office, but get to know maybe the pre-Middleton Pediatrics Dr. Von Edwins. And so why don't you share a little bit about your path personally and professionally that preceded you joining us?
Yeah.
And so you joined in...
It was right around 2020. So it was right during the heart of when everything was shutting down for COVID. So
we're
right
coming up
in
on
the
5
middle
years.
of COVID. So we're pushing 5 years. Yeah,
okay.
exactly.
So give us the prequel.
So I grew up here in Florida, over in Palm Bay on the East Coast. And my parents still live over there. One of my brothers still lives over there. So grew up over there and then came to UCF for my undergraduate degree. But I didn't go into a science degree or a medical degree right off the bat. I have an undergraduate degree in animation and storytelling. And so did that for a couple of years. And then when you have an animation or storytelling degree in Orlando, where do you work? You go to Disney. And so I worked at Walt Disney World for a handful of years as a puppeteer. Was basically my main job.
Not just any puppeteer.
I was, as we were taught to say, I was good friends with Bear in the Big Blue House back in the day, which was by far my favorite role to perform while I was there. It was just, it was so much fun. And
so I've never heard you say it that way. Actually, the good friends with is because that person is a thing in and of itself.
Because you don't want to take away the magic from people who, young ears is what it boils down to, is good friends with. Yeah.
Great.
And so did that for a bunch of years, absolutely adored it. It was a great time. And then started to realize that I wanted to be more involved in improving people's lives more directly and have closer relationships with just people in the world in my community, and also wanted to be able to challenge myself more as time went on. I wanted to learn constantly. I'm a very curious person. I wanted to keep learning all the time. And I started to realize that sticking around there probably wasn't going to check all those boxes for me. Ultimately, as far as personal satisfaction were concerned, as far as professional satisfaction were concerned. So I said, you know what? I think I want to be a doctor.
In retrospect, were you fascinated by science as a young kid?
I've always liked to know why things work the way they do and how things work. And I think that, frankly, not really.
But it was a curiosity more than it was science specific.
Yeah. And then seeing just the joy that being friends with Bear and working at Disney brought to children and families, I thought, what's a way that you can see that and be a part of that and give that on a daily basis while also helping and really just giving back. And I thought, maybe I can go into medicine and do this and I'll be a doctor. And so I went back to UCF, did all the prerequisites. I was the old guy in class at that point because I was in freshman biology in my mid-20s at that point. And then went to med school down in Nova Southeastern, down in Fort Lauderdale. And while I was doing my rotations there, trying to decide what I wanted to do ultimately, I realized that pediatrics is the only thing that will fit for me. I get to play all day. I get to see kids. I get to be a part of families. I get to tell them they're doing a good job. That's my favorite part of the whole thing. Once I decided on that, I went to Arnold Palmer here in Orlando to do my residency. Did an additional year as a chief resident there as well. I was introduced to you and we started talking a little bit and just really felt like, man, this personal mission that I've had on what I want, what is going to bring me joy in the world and how I want to leave my legacy in the long run is exactly what's happening in this building. And it all worked out pretty well, I think.
Do you stay in touch with your friend, Bear?
Not really. No.
Is that still around?
It's not really. No, it was a Jim Henson production.
As soon as you left, it just kind of.
Yeah, they said, we've peaked. There's no, it's all downhill from here. The only connection that I really have for it anymore is Bear sings a happy birthday song in one of the episodes. So whenever it's a friend's birthday, they get a link to that YouTube video for their birthday.
So do you have voices and stuff?
Yes.
And do you pull them out in the room? Because I'm not in there with you.
Occasionally, yeah, okay. Occasionally. Admittedly, I'm sure a whole bunch of it is just for my own entertainment sake while I do it. The time that I do that the most is with my sons, though, with Colin and Rory. They're 11 and 8 now, and they might know my normal voice 30% of the time, and otherwise I'm goofing off constantly with them. So it really is all about play for me. I love play. I think it's so important for just our relationships as human beings and just enjoying this life that we have.
Yeah, that's probably a whole nother episode there, the importance of play. Let's jump right into some summer pediatric topics. We can go in any order you want. You have any?
Oh, I'll tell you, recently I've seen a couple of cases of hand, foot, mouth come in. And when we started talking about this, I went, oh, that's a great one for this, because this is about the time we start seeing this kind of into the spring, into the summer season. We start seeing these kids who maybe have a little bit of a runny nose for a day or two, some fever, maybe a little bit of sore throat, and then they start getting this rash on their hands and feet, often on the palms and soles that kind of moves up the arms and legs sometimes. And families come in and they say, what is this? And go, there it is. It's the hand, foot, mouth.
It kind of has some gravity to it. I don't know if it's the name, if it just creates a lot of, it admittedly it can be a very miserable illness for kids. But so you alluded to the fact that it's more common in spring and summer. Mm-hmm. Any other highlights about it, whether the ages? You talked about the presentation generally.
Yeah, a lot of times it's really, it can show up in anybody. By far the most common are going to be these preschool age kids around that age. And a lot of that is probably has to do with how it's spread, which is through saliva droplets, also through stool, and kids at that age, they're touching everything and they're not washing their hands great. And so it's easy for it to spread through situations, through those, through daycares and school settings and things like that. I think the other big thing that comes up with it is, and you're right, it's got a lot of gravity, and like, parents are always say, oh no, not hand, foot, mouth. And you go, well, actually, you know what? It's kind of a rite of passage for kids, because most kids are going to get it at some point in their life. And typically it's just maybe a little bit of a miserable experience, but it's a viral infection more often than not. Their little immune systems will fight it off without problems. And as long as they are comfortable and they're not getting to a point where their throats hurt bad enough because the lesions potentially in the back of their throat, that they're not hurting bad enough that they can stay hydrated during that time, you say, all right, just wait it out. Time, the tincture of time will fix this and your immune system will get this. We just got to make sure you're comfortable in the meantime.
So that would be usually the misery factor is proportional to the mouth. The sores in the mouth.
Yeah, in my experience, it seems like that's the thing that bothers the kids the most. I mean, sometimes you'll feel like they're maybe a little itchy on their hands and feet or their legs and arms, but really, I feel like the tipping factor for discomfort comes from these lesions in the mouth, because they essentially look like a bunch of canker sores back there, and
right,
they're really going to be just uncomfortable.
Yeah. So the cause of hand, foot, mouth is generally
viruses. Yep. Ultimately, most commonly Coxsackie virus. There are other viruses that are in that same family, but by far Coxsackie virus is the most common.
One of the things we'll get asked a lot is, there's so many illnesses that once you get it, you feel like, oh, well, I'm done. Coxsackie tends, because Coxsackie's a family, not an individual. Yeah. And so kids will get it repeatedly. It's not uncommon at all for kids to get it repeatedly.
Yeah, it's certainly not a one and done. And boy, it would be nice if it was, wouldn't it? And that's true for kids. So sometimes we'll see kids and families go, "Oh, we did this last summer." You know, yeah, sorry, there are multiple strains, and although you might be resistant to that last one or immune to the last one, this is a different one, and the immune system won't necessarily identify those as being the same thing. It is also possible for parents to get it. So this is where that hand washing comes in really important when we're around this. And not my personal experience, from what I've heard from other parents who have picked it up, the parents are really miserable. It really feels like it hits the parents harder than it does the kids in these cases. Yeah.
All right, so it's a clinical diagnosis, and so explain what that means.
When somebody comes in the office or when we talk to them on the phone or a video visit, we should be able to make this diagnosis not only just from the history that the family gives us, but the physical exam that we do. Ultimately, those two things are across the board in medicine the most important things, the most valuable things that we have. And in this case, especially the story, the physical exam are going to almost always be the thing that helps us to diagnose this ultimately, which means that you don't need to do any laboratory testing for this. We don't need to do a viral swab on a kid for this. We don't need to do a blood draw or anything like that. It really is just so, hey, you know what? This is what it looks like. It fits the picture so well. The story fits the picture of hand, foot, mouth, and we can trust that that's what
That's
it
probably
is.
a good way to say it, that because we use these terms, and I don't know that we communicate. Clinical diagnosis is really in contrast to laboratory diagnosis or some other diagnostic test.
Mhm.
Clinical diagnosis meaning this picture. So that's how it's diagnosed. And then I think I wanted you to maybe pause and elaborate. And the treatment for it is,
Well, it is viral, so it's time.
yeah,
Yeah, it's really just that supportive treatment. Make sure the kids are comfortable. Make sure that if there is any discomfort, using your over-the-counter analgesics, ibuprofen, Tylenol, acetaminophen, things like that, to really help keep them comfortable during this. Make sure they stay hydrated. But there's no antibiotics for this. There's no antiviral medications for this. It really is your immune system will take care of it,
yep,
and you just got to give it a little bit of time.
yep. And not uncommon to a week or so later have some significant
The
peeling.
peeling,
Yeah.
yeah, I think that is just as striking as the rash itself that comes up. Is sometimes a week or two later, you get relatively significant peeling of the fingers and toes and hands and feet sometimes. That is sort of a expected part of this process, especially in the more significant cases. Yeah. And even with those, it's just supportive care through that as well. There's nothing extra you need to do for that.
So a little bit of an ominous name, really common,
Yeah.
generally not something to worry about. I do think sometimes almost the presenting symptom is excessive drool due to these sores in the mouth. The kids won't even swallow their own saliva.
Yeah, I think it's a great point because it really is so common to see that in the kids. And I think that, as you say, that is what probably tips me over the edge to say that it's probably those sores in the mouth that hurt the most. Because if you're not even at a point where you can swallow your own saliva, and it's got to be uncomfortable at that point.
So Coxsackie, hand, foot, mouth. I think that's interesting too. I mean, one of the things that we don't always do a great job of is communicating in understandable language. And I think
Mm,
the idea that there are disease entities and then there are causes of those diseases.
mm.
So croup is a disease, parainfluenza is the virus that causes it, bronchiolitis is the disease, RSV, and so Coxsackie being the virus that often causes hand, foot, mouth. Anything else you want to say about hand, foot, mouth?
No, it's just like wash those hands.
Yeah, that's right.
Wash those hands.
Okay, so let's move on. What else summer do you have for us?
Something else we see a lot during the summer is swimmer's ear.
Okay.
And part of the reason I felt like this was an important one to talk about is because it is a drastically different treatment than a typical ear infection that we see with kids. So frequently, pediatric patients,
I'm
kids,
pausing you. When you
yeah,
say ear infection in kids, most of the time what people are talking about is
a middle ear infection.
middle
Yeah.
ear
So
infection, otitis media. Yeah.
incredibly common in kids, otitis media, the middle ear infection
Basically,
is
ear infection associated with a cold,
right. And I
with
think that's
congestion.
Yeah, and I think that's one of the big differentiating factors here with swimmer's ear versus these middle ear infections. Because when people say my kid's got an ear infection, they typically mean an otitis media that was associated with a cold that for most kids potentially needs an oral antibiotic to treat that. The reason you need an oral antibiotic for that is because that infection is behind the eardrum in there. And so you need to come from the inside out. You need to get to the source, and the eardrum is impermeable. And so just putting antibiotic drops into the ears really isn't going to give you the effect that you need to treat those middle ear infections that are the otitis media that come along with the colds. And I think that's one of the big differences between swimmer's ear and the classic ear infection is for swimmer's ear, it's once again a summer thing because swimming. And so you've got a setup where you've got these ear canals that are wet a lot of times because kids are swimming, they're out doing things, and all of a sudden they start complaining of this pain in their ear. And parents come in a lot and they say, "Oh, there's they have an ear infection. They're having ear pain, so it must be an ear infection." And you look in there and the eardrum looks okay. And from what you can see, behind the eardrum looks okay, but the canal is really red. It's really swollen. And you move the kid's ear around. They're like, oh, ow, oh, oh. And what's it's not fun. It's painful. But the nice thing about that, because it is on our side of the eardrum there, you can treat that with some antibiotic drops in those cases, and which I think is really one of the big differentiating factors here is this is the canal itself, that the hole that you can see, the canal that's leading down towards the inside of the ear, that's what's actually infected in this case is that skin. And we can treat that with the drops. Whereas if we had this traditional ear infection with a cold, you have to use an oral antibiotic a lot of times for those as well.
So retained water,
hmm
kind of the setup that causing this. What about ways? So my question is a leading one: preventing it, preventing swimmer's ear.
A lot of times that's the advice that I'm giving during these appointments as well. Is well, let's treat this. Let's get this fixed. But then what are we going to do from the rest of the summer to help keep this from happening again? One is trying to keep them as dry as possible. And so using things like a tissue or something like that to absorb as much water out of the ear canals as you can so that standing water isn't there can be helpful. The other is that you can make these kind of little concoctions of a little bit of rubbing alcohol, a little bit of white vinegar, and put a couple drops in the ears after swimming and just let them sit and then kind of let them drain out on their own, which help to change the pH in there with the vinegar. So it kind of maybe keeps some bacteria from forming. And then the alcohol is really volatile so that it helps the water actually evaporate out of there a little bit quicker. So you're less likely to be dealing with this standing water situation that precedes and kind of leads to these swimmer's ear situations.
Yeah, and that standing water is such a great way to say it. I mean, one of the these basic ideas of infections and all throughout the body is when fluid is just stationary, stuff likes to grow. And that can be stationary in the ear canal, that can be stationary in the bladder, whatever.
Yeah,
That
the appendix. I mean, I
that's
always
right.
say something that's supposed to be draining and isn't is just primed for an
Mm.
infection.
So swimmer's ear, talked prevention, treatment. You alluded to the typical signs in the sense that it is pain with movement of
Mhm.
the ear because it's an outer ear infection. It does seem like, in some ways, and I know all these exist along a spectrum, but outer ear infections in some ways seem even more painful than middle ear infections. Often, I mean, it's all degree, but crazy painful.
Yeah, and typically not coming with the fever and things because the other ear infections, the classic ear infection, the otitis media, often is coming along with a couple days of congestion, some fevers that are going on, and maybe some ear pain as well. But usually the presenting symptom, the thing that the kids are complaining about with swimmer's ear pain. It just hurts.
All right, let's move along. Other summer stuff, sunscreen.
Here in Florida, especially, we do not get a break from the sun unless we actively make sure it happens and go inside or get in the shade. And so it really is one of those things where it's so easy to go to the beach or to the theme parks or just out to the parks in the neighborhood and things like that. And just go, oh, we're not going to put it on this time. We're not going to put sunscreen on this time. We're not going to, or forget about it. And it's just one of those things that just has so much importance for not only not getting burnt now, but for setting our kids up for success in their lives and as healthy a lives as they can lead in the long run to prevent skin cancers and things to say. It's just one of those things we really got to make sure we're doing with the kids in these
Do you
cases.
ever get asked, uh, w- do you have a recommended sunscreen, Dr. Von Edwins?
All the time.
Okay.
Yeah. And for me personally, I would just prefer that somebody's using something as long as it's got, and I always say use the highest SPF you can get out there. So at least 30, but if you can get higher than that, get the 45s, as high as an SPF as you can get. I prefer things that don't have a lot of fragrances in them, not a lot of colors and things, because those can tend to irritate some kids' skin. But as high as an SPF as you can, and use it. And that's the most important thing.
There's so much about this that can get confusing, and part of that is there's so much marketing, and
Mm-hmm.
the products change and stuff like that. I mean, even the SPF, I think the dermatology recommendations tend to be, like you said, 30 to 50, um, which, there's interesting things about this that, if you asked, well, what does that number even mean? Um, this, well, let me back up. I think sunscreen sometimes feels like you need a master's in organic chemistry to even understand the ingredients. It's really confusing. And so just in this basic sense, you've got physical filters and
Mm-hmm.
chemical filters, right? The physical ones that you can see them, the
Right.
white,
Sure. Yeah.
that start working instantly
Mhm.
because it's a physical one. The chemical ones that were the ones that you got to wait 15 or 30
Right.
minutes. And it seems like all the concerns come with the chemical ones,
Mm-mm.
and yet all the inconveniences come with the physical ones, right?
Sure. Sure.
I feel like if we had a mom of young kids, and if we had, Brianna on here, and like we should, some tips for applying sunscreen to a family of 6.
I'm sure it's an undertaking.
Yeah.
Yeah, even just to put it on my 2 boys, it's an undertaking.
Got any tips? Any tricks?
So, admittedly, that this actually might be a
Puppeteer
Brianna. This
voices?
might be a Brianna. Not this time.
Okay.
Admittedly, this might be a Brianna special for applying sunscreen, is using a makeup brush and squeezing it on there, and especially for the face and things like that,
Mm.
is it seems to just spread it around really easily, and it tends to not irritate the kids as much, because you're right, some of those, especially the physical barrier ones that make they're pretty thick and sticky, kind of like diaper cream,
Yeah.
and it can be a little uncomfortable to smear that around on the face. And so using one of those makeup brushes, I've found even with my boys that it works really well.
So it does seem like just some basic terminology as far as if you look at what AAP and dermatology recommends. Broad spectrum just
Mhm.
means both UVA and UVB.
Right.
I didn't know this, but apparently some would say UVA are the ones that age you, and UVB are the ones that burn you. I mean, kind of a mnemonic way to remember it. The B is the one that's kind of midday,
Mhm. Right.
hot months, and
Mhm.
A is just kind of always
Yeah,
there.
always there, even in overcast days.
Yeah.
I think that's something important as well. Even on the days, because we know the afternoons get overcast here, you can still get a sunburn and get skin damage even when there's clouds in the sky.
Mm.
And so even on those days, if you're going to be outside, you got to apply just to make sure. And that you're right, the broad spectrum, because at that point you need both, especially in those situations.
And again, these products keep changing. Just when you look at there's the concerns with them. It seems like it's, as minor as irritation to the child, and uh, you know, damage to the coral reefs, and hormonal changes with some. Question of, not proven. And so, I think the AAP, it seems like, would say, under 6 months, it's avoid. 6 months onward, it's physical ones. So zinc oxide, titanium dioxide, the harder ones, to the physical ones. The idea of reapplying every couple hours, more frequently if you're in the water. It's so important. And then it feels like we sometimes give these recommendations, and I wonder the implementation of them is not as smooth
Sure.
as what we might recommend. But
Can I ask you a question
yeah, for
about this?
sure, please.
And so I think this is a little bit of wisdom and experience that comes along with this, is because frequently a question we get as well is, we're taking the 2-month-old or the 4-month-old to the beach with us or to the pool. Can we put sunscreen on the infant, on the kid who's less than 6 months old? What is the advice that you give families with that
Yeah,
question?
so I will say you can. The couple issues when they're young, their skin's thinner, more prone to damage, burns. Their sweat glands are less developed. Can legitimately overheat. And so a lot of the recommendations of none under 6. I'm talking to you like I'm talking to a parent. The They don't want people under 6 months using it because they may feel a sense of permission to be out more than they should. So, to whatever degree you can, try to avoid those peak times. Try to use covers, hats, long sleeves. But if you have to, feel free to go ahead and do it, and using those physical ones, the zinc oxide. And so that's generally how I answer that. I want them to sort of understand there's nothing magical that happens at 6 months that says now it's safe. Parents are smart. They want to know the why behind a lot of this stuff. So that's generally the way I answer that.
That's exactly what I tell families as well is hey, just we don't want a feeling of overconfidence that because I put sunscreen on the kid, we're going to be just fine at the beach for 4 or 5 hours at a time. It's like,
Yep.
no, if you're a little bit uncomfortable, there's a really good chance the baby's pretty uncomfortable too. And so just as long as use the sunscreen, as long as you're really cognizant about the fact that this is really more about comfort of the baby and making sure that we're not overheating or having some of those risks of dehydration, things like that while we're out in the sometimes sweltering heat.
Water safety. Anything on that to say about that?
This is the time of year where everybody's going out to the pools, everybody's going out to the springs, to the beach and things. And really, I think the big thing with water safety is just drownings are a huge source of injury and sometimes very severe injury to kids. And it's completely preventable ultimately. And here in Florida, especially, and I saw this a lot when I was at Arnold Palmer, is we have a lot of families from all over the country and who are at these resorts at the hotels and things. And we would have numerous kids each summer come in with drowning injuries, some of which were incredibly sad cases. And to just kind of go into those and say, I think all parents go, I could have done more. I could have done more in these situations. And to feel that, I can't imagine how difficult that is ultimately. And really just to lean into it's all there are so many things you can do to help prevent against these things, but the number one thing that you can do when it comes to water safety is constant observation, is never leave kids around bodies of water. And that's not just pools and the springs and the beach. That's the bathtub, that's the toilet, that's a bucket of water in your backyard. Never leave kids unattended, especially mobile kids, unsupervised around where any body of water can be, because supervision is the number one and only thing that actually prevents against
Yeah. So
drownings.
we, have the unfortunate distinction of leading the country
Yeah.
in childhood drownings. And so layers of protection, kind of one standing out above others, meaning supervision, but others as well. I
Right.
mean, there's CPR being a layer of
Mhm.
protection. There's, flotation devices and
Right.
appropriate things, barriers.
Right. Yeah. Fences,
Yep.
covers, all that.
Yeah. I
Absolutely.
mean,
Yeah. Locks on doors. Mhm.
well, and even door alarms, I think can be provided free.
I think it's part of the code as well at
Okay.
this point. We have friends who had to put in just a couple of years ago, and they had to have alarms
Okay.
put on their doors. And this was an existing house. So it wasn't even built into. They had to have those installed in order to pass code.
We may be able to put it on a show notes or something. I do think there's a state program that will provide you with free door alarms.
Mm-hmm.
I know a number of the counties do. Orange County does, but I think you have to be in unincorporated Orange County. I think Seminole does, but I think the state does as well. I read something that said 70% of drownings happened when it wasn't even a swimming activity, meaning the child had wandered
Mm-hmm.
away. They weren't even about swimming.
Yeah, boy, talk about terrifying. This is something that I've thought about a couple times. Um, and actually while I was doing some reading for tonight as well, is I think in the moment where all of a sudden you can't find your kid.
Hmm.
And we've all had that as parents. You're in the supermarket, you're somewhere, and all of a sudden you're like,
Right.
where'd my kid go? It happens. They're humans. We're humans. The kids are gonna do what they're gonna do. But especially in a situation where a house with a pool or anything, if I like to hope that if I was in this situation where it's like all of a sudden I can't find my kid, I'm gonna go look in the water bodies first. Because that to me is one of the biggest risks in that moment. I'm going there first to make sure that they're not there. And then I can then look everywhere else. But it feels like that's where I'd go look
Hmm.
first personally.
I want to talk about swim lessons because we
Yeah.
get asked about that a lot. But uh, do you have typical things you say to convey supervision? Because if I just say make sure everyone knows that.
Right.
How do you help them translate that into something they can implement or something applicable?
I think in order to give it the gravity it deserves, I always make sure to say, look, really, this is the only thing that can actually prevent a drowning when you're out there is to have supervision so that you are there within an arm's reach to grab a hold of a kid if you need to. I think when we say supervision, it can be, oh yeah, we were all out around the pool. We were all sitting there. We were talking. The adults were over here talking. The kids were playing. Well, something can go wrong in that moment as well. And so one, I think that's really important is summertime's a fun time. And a lot of times with pool parties, barbecues and things like that, there can be alcohol involved. You'd hope not drugs and things, but potential. And so being having observation of the kids that are swimming and watching that means you need to be as much in your right mind as you possibly can in that moment so that you, if something does come up, you are 100% capable of making the moves that you need to in that moment. So it's not observation. It's observation, but good observation in this case. I think the other part of that is that I've seen at some of these swim parties that I've been to, and I've seen on the AAP's website and different websites as well, is they've got basically these lanyards with a card on them that are like, right now, I'm the official pool watcher. I'm the
Right.
kid watcher right now. And which I thought was just fantastic because it does a couple things. One is if you go into that day with a bunch of different families or just your family saying, hey, we're going to take turns doing this. When you put that lanyard on, there's this, and you have that card, there's this feeling of like, I really am very, very responsible here. So there's some personal accountability that comes along with that. It also, I think, can help other people feel safe to say, "Hey, we have someone whose job right now is to do this," and to feel more comfort with that as well. And so I think that can be a really helpful situation is to say, "Hey, I'm assigning you this job right now, or it's my turn to take this job, and I'm going to take it seriously for this 20, 40 minutes, whatever you decide." Um, to make sure that that's where your focus is during that
Yeah, I
time.
love that because one of the things we've said forever is this idea of really clear handoffs.
Mm-hmm.
Because I remember when our kids were young, and my wife would say, "I'm going to get something to drink. You've got them," and I'd be, "Oh yeah, 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 I got them. Okay." And she's like, "Nope, look at me, and let's go over this." And she'd maybe say to the friend, "He's not available for the next 10 minutes because he's watching the kids." The lanyard idea is such a tangible manifestation of the assignment
The handoff,
of
yeah.
a
Hmm.
handoff. It also is it's a signal to someone else like, hey, don't go talk to that person.
Right.
They have
This
a
is a great
job
point.
right
Yeah.
now.
Yeah. They're
Um,
doing something very important right
that's
now. So
right.
let's let them do that in this moment.
Yeah,
Yeah.
and even if you have a lanyard around your neck and you're on your phone, someone hopefully you would be shamed, because
Yeah.
like you're not supposed to be on your phone,
Right.
you know. Um, and I think the other thing that's good about that uh, is the system. One of the things we'll say to families is it often, I mean, the same type of thing you were saying, like we don't like for parents to parent with a pervasive sense of paranoia. This is one thing you probably should have some paranoia about. And usually, at least one of the parents does. Um, but sometimes other caregivers may not, and they may not be living this every day. And if I say to a grandparent or someone, "Hey, you have to watch them," their initial reaction is, "Don't you think I know? I raise kids too, whatever." And yet if you say, "Hey, you know what, mom? Our system is this. We do 15-minute shifts. We use timers. We put our phone off. You're not doing anything else when the timer goes off. Even if you're fine, you take a break just to read, some, hey, mom, please do our system." It's a little bit easier than them feeling browbeaten into, you have to watch. The lanyard's a great idea though. That's
Yeah. And I don't know for sure, but these were commercially made. And whether it was something you can just download off a website for free or something you order online. But either way, I agree. It's nice to have that very clear communication of right now,
mm,
you're responsible.
yep.
You're in charge right now. And then I'll come take that from you at some point. But this is the clear communication that we have someone watching.
Yeah, so supervision's paramount. Let's shift to swim lessons. Any high level comments you have on swim lessons?
I personally like them.
Yep.
I think that getting kids comfortable in the water is important. I mean, it's fun to go to these parties and things like that, and you want your kids comfortable in the water ultimately. Um, I was doing a little reading on through the AAP, and they recommended that preschool age kids do swim lessons because they can actually learn to start getting into it and do the swim lessons, and didn't necessarily endorse the infant rescue swimming, the that we see a lot of people do, and they didn't say not to do it, but they also said, we can't encourage you to do this. We can't recommend it. There's just not enough evidence that says it has um, helped enough people or saved enough lives to say, yes, you should absolutely do it. I did it with my sons. And um, even knowing what the AAP says about that, I probably would again, in all honesty, because it isn't going to hurt anything ultimately. And for me, and the kids did a lot of like flipping over on the backs and things like that. I never took it as comfort at all. The way I took it as is if something happens and it maybe buys me a second, that's good enough for me. That's not a substitute for physical barriers, gates, locks, alarms. That's not a substitute for watching closely. It's not a substitute for not being in an altered mental state or mind when you're watching the kids in the pool. It's not a substitute for any of that. If there's even a smidgen of it maybe helping, it for me it was worth its value.
Yeah, you're younger than I am, but there's been an evolution of AAP and swim lessons.
Has there?
And so we have 4 kids, 27 to 17. All 4 of them did infant swim and started really, really young. So going ahead and showing my hand, huge believer in it. The AAP used to say no swim lessons before 4, developmentally not ready. Then they sort of revised the statement, maybe 2010 or something, that said, we think you should at 4, at 1 to 4, you can, if it seems, if they seem ready or if
Right.
you're or whatever. There's some talk that they're going to revise the statement even more because right now I think it's, but not before 1.
Mhm.
Don't do anything
Right.
before 1. And, I think there's going to be a statement that's a little bit more, well, these might be helpful even as soon as mobility starts, right? As
Right.
soon as
That's
they
what
start
mhm.
crawling. And so anyway, I think it'd be great to have Harvey Barnett, the guy that started ISR,
Mhm.
as a guest. I mean, to talk. We had him come speak at Grand Rounds at University of Florida when
Fascinating.
I was chief resident. And at that point, so that's, what is that, 2002? uh, it was really not embraced by the pediatric academic community.
Interesting.
And yet he'd been doing it for decades already.
Right.
And he accumulating a lot of data. All right. Vaccine policy. Get asked about this a lot.
Yep. A
Yeah.
lot.
And maybe even more of late. One of the things that we used to do prenatal discussions with families who are pregnant here in the office and sort of just, hey, come, we would love for you to know a little bit about us as you make a decision. This preceded Dr. Von Edwins.
Yeah, I never got to be a part of
Yeah,
any of those.
these were, but we would discuss this, and I think it was so helpful to be able to do this. And I'm sure you get asked about it a lot at visits. That we do have a vaccine policy,
Yeah.
but we don't get the chance to communicate the spirit of it
Right.
a lot. So what we would say and still feel so strongly about is, we could not feel more confident in both the safety and the effectiveness of vaccines. We do realize that there's a lot of fear around everything as it relates to parenting. And so just this genuine concern, we realize there's a lot of differing opinions on vaccines. We would say we think they're based on bad information and bad science. But we do realize that different people have different opinions. And we feel so strongly about a pediatric relationship being one based on trust and longitudinal and for the long haul. And we sincerely really do not want families in a position where they're being pressured to do something they do not feel is best for their child. And yet, similarly, we don't want to be in a position where we're being asked to do something that we think is actually bad pediatric medicine. Even a deviation from standard of care, what we think is good pediatric medicine. So, because each of those things, trying to be clear about how we feel about it. And if someone feels differently than we do about a core aspect of pediatric medicine, that's just not a good basis for a long-term relationship. We don't want families feeling pressured to do it if they don't, and nor do we want to feel pressured to do that.
And just to
Yeah.
clarify with, as you mentioned, we have a vaccine policy in the office. That policy ultimately is we intend to vaccinate on time, every time, without deviation to unproven schedules, uh, because we know that the good evidence, these studies that have looked at millions of kids, um, show that that, as you said, vaccines are effective, they're important, they're safe, and arguably one of the most important medical things we do in the walls of of this office, but every other pediatric office out there, is to immunize kids against these illnesses and these diseases that really can be absolutely detrimental in their lives.
Yeah. And we really, we don't want to have debates at your child's appointment, And so I think sometimes people think we don't want to talk about vaccines. And I would say, oh, opposite. We love talking about vaccines, meaning I think they tell their own story so well, and have been such as you said, just such a dramatic benefit to children and their well-being and their lives. But we don't want to have debates. We don't want families to feel pressured. And really, if a family feels like they're being forced to do something, we're like, that's not true. The only family that might feel that is someone who's wanting to stay, but not wanting to vaccinate as scheduled. And so it really isn't an idea of an unwillingness to discuss them. We love discussing them. And it's not trying to force. It's actually kind of the opposite. We're trying to say, if you don't feel like this is right for your child, we feel completely differently, and this just is not a good place. You do want to be somewhere that sees eye to eye as you invite someone to come alongside you as you care for the most important thing in your life. So, yeah, it's a hard one because you want to communicate it in a way that is truly understanding. That I do
Yeah,
think, almost without exception, parents are just trying to do what they think is best for their child
always.
ever,
Yeah,
and yet we're doing the same thing in the way we care, and we just feel strongly that this is in the best interest of children.
right.
And there are issues as it relates to. I mean, there are plenty of people who come through our doors who are vulnerable.
Mm,
A lot of those are because they're infants,
right.
newborns,
They're
and they
just not old
can't be.
enough yet.
And
Yeah.
then obviously a handful that are immunocompromised.
Mhm.
But I think as much as that may be an issue, the larger issue really is this: do we see eye to eye as it relates to the core tenets of pediatric medicine? And if we don't, then this is not a good starting point.
Right. I think I think that's one of the things that really stood out to me about this ultimately for us as a practice, as these parents, as you're saying, they really are just trying to do what they feel is the best thing for their kids in that moment. And that's admirable. That's understandable. You love your kids. You want to do what in that moment you feel like is the most important thing and the best thing for them. And I really think that part of having a meaningful relationship, which I think families want to have with their
Mm,
pediatricians, and frankly, their physicians as they get older as well. I think that's part of one of the things that we're kind of losing a little bit in the world of medicine, is that personal relationship just isn't there as much. And saying every time we come together, there's going to be this tension of these two things.
mm,
No one's going to feel like a safe relationship in
right.
this. And we want you to be somewhere where you feel safe and you feel like you are on the same page and can have that meaningful relationship with whoever that care provider is ultimately, from a medical standpoint. Um, it really is, it comes out of love.
Yeah.
Ultimately, it really does.
Okay. How about just some quick takes on stuff in the news?
Sure. Yeah. there's enough of it.
Yeah, there is, and we're just gonna choose a handful. And so you can answer any way you want. You could your level of interest.
Sure, sure.
Are
Oh,
you
great.
hyper interested? Are you hypo interested? Are you somewhere in between? Lukewarm, whatever term you want to use. A lot of talk about fluoride and fluoride in water. I think Utah may have just voted to take fluoride out of their
I knew it was
water,
coming up. I didn't know what day it was happening.
and I think
Yeah.
it's now sort of uh, on the conversation docket for Seminole County.
Yep. Yeah, that's what
Um,
I heard too.
what's your level of interest in that?
Relatively high actually,
Okay.
because yeah, I do think it's important that we have that. And I think part of what has led to a little bit of this was a recent article that came out that kind of alluded to that maybe fluoride in water and IQ levels in kids maybe inversely related, meaning that as fluoride levels go up, potentially IQ levels could decrease. Well, the thing that got me about this was most of that data came from out of the United States. It wasn't here in the United States, and the levels of fluoride that were in the water that they tested were markedly higher than what we have here. And so interest for me in that it's relevant because this affects a lot of people. So if we start taking this out of the water, and we know tons of evidence that says that fluoride is so protective for helping the teeth stay strong, the enamel of the teeth stay strong to help prevent significant dental issues as far as like significant cavities, what we call dental caries. So essentially rotting of the teeth and things. It's very helpful with those things. And the evidence to the contrary or that it's dangerous it's just not out there enough
Mm.
for me to worry about it. My kids drink we grew up drinking out of the hose
Mm.
out of the house and drinking
That
tap
explains a
water.
lot,
I
actually.
mean,
Yeah.
maybe it is.
Yeah.
That was more the sulfur, I think. Well water was awful growing up. But I think for me ultimately, I don't worry about fluoride in the water. I will continue drinking the tap water and my kids will as well. I worry that as um, maybe a little bit of fear starts to sneak into the
Yeah.
world, that if it starts to disappear, we start seeing the repercussions of that, and especially in the dental world.
Yeah, I
So
would
this is,
love a future episode to have a pediatric dentist on. I think,
yeah,
and this would be
mhm.
something we'd talk about. I mean, I would say my level of interest is uh, kind of half-hearted, kind of in the middle. I think it probably is important. What I almost my interest is more. I'm just so bothered by scientific discussions being proxies for political fights, and this just feels like another one of those. And just this idea that Francis Collins has a statement that just talking about how science and politics shouldn't mix, that when they mix, what you end up with is just politics. And this just feels like another example of that. All right, moving along. Louisiana reported first deaths from pertussis. I think a couple of infants. First deaths in, I think it was 7 or 8 years. So pertussis being whooping cough. What's your level of interest in pertussis and whooping cough potentially rising?
We all have to have significant interest in this, especially considering how many cases of measles are out there now and whooping cough pertussis and an overall rise in the number of vaccine preventable diseases that can be detrimental. I mean, just can be deadly ultimately. I think it deserves our interest in these cases because it's we're seeing things show up all of a sudden that we haven't seen sometimes in decades, but especially in many, many years. And all of a sudden they're on the rise. It's worrisome. It's a little nerve wracking.
Yeah.
Yeah.
Yeah, I think this one interests me a lot too. Just the idea you probably make an argument that whooping cough and measles are the um, two canaries in coal mine who would start to show themselves first for different reasons. Measles being uh, so contagious. Pertussis is actually quite contagious as well, but immunity with pertussis being one that wanes and need for boosters and things like that. I think that the if we are going to start seeing reemergence of vaccine-preventable diseases due to lower rates. It feels like those will probably be the two first ones. Measles in smaller numbers, pertussis in much larger, but both potentially tragic.
And I think part of what goes along with this, especially with pertussis whooping cough, is when we talk vaccines, a lot of times with these things, we're all once again, we're focused on little kids. And really, this is a situation where, well, this is one where the older kids matter too, and the adults matter in our world. So at 11, making sure that we get that tetanus, diphtheria, pertussis vaccine at, and then every 10 years after that, because it really is helping protect all these babies who are most prone to having severe complications of this. We're helping protect them as well because our immunity does wane over time. So we need those boosters. And then that's why the ACOG, the American College of Obstetricians and Gynecologists, that's why they recommend women get uh, tetanus, diphtheria, pertussis boosters during their third trimester of their pregnancies, because we know that immunity can wane, and we want those kids to come out with as much of the antibodies as they can.
Yeah. So the idea there, which is a great thing for you to point out, that if mom, even though if she's currently protected against pertussis, getting a vaccine during pregnancy can raise her antibody level right at the time it's going to cross the placenta,
Right.
provide this temporary protection to the baby until that baby can get their own protection from their own vaccines. Yeah. So there's so many ways these things are being approached and tackled. All right, moving along. There's some federal discussion about getting whole milk back in schools. I was not aware that whole milk had been taken out of schools.
Same. Yeah.
Actually, whole milk and apparently 2%. And it's
So
just
it's
low fat, maybe 1% in skim. I don't know, or something. Yeah.
White water.
What's your level of interest in whole milk getting back in our schools?
Middle of the road, maybe, honestly. If I were going to pick a battle for nutrition in schools, I'd pick the battle of making sure that the school provided lunches are much more nutritious than they are now. I know that there's been a lot of change in those, and sometimes looking at what is considered a whole wheat or a vegetable or a fruit in these cases, you kind of go, seriously, really? And so I feel like if there was going to be a change in focus on something in schools when it comes to nutrition, just the overall nutritional value of the lunches that are provided, or any meal that's provided by the school, if we could increase that in general, I don't think the milk is worth the energy. I think you could really put that energy somewhere else.
Yeah, share the same sentiment. I have no problem with whole milk being back in schools.
Yeah.
It seems like if address sugary drinks more than the whole milk, and I appreciate the effort as far as, obviously, this nation. The spirit of it was this nationwide epidemic of childhood obesity. Where are some ways we can try to address that? This was one such thing, but to your point, it's probably a relatively minor knob to turn.
Yeah, and in that spirit of it, I appreciate that as well. I really do. And I think the thing that came to my mind was does one carton of milk a day, is it going to make that big of a difference? Maybe in large numbers, but for any individual, what's going to matter is, are you eating healthy otherwise? Are you living a healthy lifestyle? Is your family giving you an example of what a healthy lifestyle looks like on a daily, weekly, monthly basis? I think that's going to play a bigger role with helping slow obesity epidemics and things like that.
Yeah, and I'm a big fan of milk for kids. I mean,
Same,
obviously,
yeah.
it's just, but this discussion about whole versus, and then what about chocolate with added sugar, all these type of things. So, all right, last one. Recent study that excitedly potentially identified a single virus as the cause of Kawasaki disease. How excited are you about this at this point?
There's so many things out in medicine where we go, yeah, we know what this looks like. Kawasaki, we know you're going to get a fever for a handful of days. You're going to get a rash. You're going to have all these other symptoms that come along with it. And this happens in medical school and in residency and stuff. You learn how to identify these things, how to diagnose them, how to treat them. And then you go, yeah, but what causes it? And everybody goes, no, we don't really know. We have some theories, we have some thoughts, but we don't really know. And I think that it's it's pretty interesting, I think, from a medical standpoint, especially to say, hey, if we can get to the root of these things and find out what the actual cause is, well, maybe we get a better way of treating it, a better way of preventing it ultimately. So it's relatively interesting, I think. Yeah.
Yeah, I'm super interested in this for two reasons. I think one is if you're a parent of 2.5 kids, you probably are never going to come across Kawasaki disease. But as a pediatric practice, we do regularly, and we think about it a lot. And it has been this mystery as far as what's causing it. And the idea that potentially recognizing that it is a single virus, then later identifying that virus. Anyway, that to me is exciting. And the second reason it's exciting because it's just this reminder that there are nameless, faceless grinders out there doing great scientific research that maybe isn't going to benefit my kids, but it might my grandkids.
Right.
And just the way science advances with this relentless curiosity. Anyway, I just love it. And you have this mistaken thought sometimes that medicine has arrived and all that needs to be known is known. And it takes about half a day in the office to realize how untrue that is.
Right.
And it's just exciting for me to see maybe something in its infant stage of discovery as far as watching this story play out. So, all right. Well, hey, thanks for this. So just again, probably one every 4 or 5 episodes, you and we'll bring in some other team members and introduce them so people can get to know. And we would love for people to submit questions, topics. There's mechanisms to do that. So we can talk about those things. But really the spirit of it is just maybe just kind of this, again, we need to come up with a name, this Mark Street mishmash of discussion.
Yeah.
So,
maybe people can submit their name ideas too.
Yeah, that's right.
We'll see.
Because obviously they can come up with something better than I can. All right. Well, thanks.
Yeah. Thank you so much
Brad.
for having me. I really
good stuff.
appreciate it.